A Weymouth man won $1 million today, and a teenager from Chelsea won a $300,000 college scholarship. They're the first two chosen in the state's Vax Millions lottery sweepstakes.
My mom called me and she's like, you won, and I couldn't believe it.
For me to be the first one is really a big deal. It was rather important for me to actually do this in order to get the vaccination because I have family members who have comorbidities.
Governor Charlie Baker said nearly 2 million adults and around 135,000 teens have signed up for the drawing so far. It was designed to encourage more people to go out and get vaccinated. Opting for the carrot over the stick, the governor so far has been wary of any kind of vaccine mandate. But especially after the Federal Equal Employment Opportunity Commission ruled that it's legal to do so, many businesses and organizations have been taking the stick route and imposing mandates on their employees themselves. Some have also been imposing the same rules on their customers, including my next guests, James Braude, a producer at Jacques Cabaret in Boston, and Kari Kuelzer, owner of Grendel's Den in Cambridge. Thank you both for being here.
Thank you for having us.
For people who are not familiar with your operations, can you just give a brief introduction to them? And James, let's start with you. And I don't speak French. I don't know if I said Jacques right or not. So feel free to correct me on camera. Tell me about the cabaret.
Of course. So it's Jacques Cabaret. It is French. It's primarily a drag venue. We do drag shows 6 nights a week. There's an upstairs and a downstairs venue. And I am very privileged to be able to run the downstairs venue.
All right. And Kari, for people who don't know Grendel's, which is actually where I got engaged to my wife half a lifetime ago. I know it well, but some viewers may not. So tell us about Grendel's.
Grendel's Den is a restaurant and bar in Harvard Square. We've been in the same location for 50 years, and it's a family business that my parents started in 1971, then that I took over in 2003. And by the way, I am a huge fan of Jacques. I'm like really excited that you're here.
All right, great. So what I want to hear from both of you is when and how you came to the decision to impose your own vaccine mandates. James, let's start with you. How did you guys come to this point?
Mine has kind of been a personal mission since pretty much the pandemic started. So I started hiring on new performers for various shows at different bars that I'm producing about 2 months ago. And from the beginning, I've been mandating that you have to show your vaccination card. That's just part of your employment with me. I'm just not going to put people into dressing rooms if it's not safe. So about a month ago, I started talking with the actual bar owners about, safety and how are we going to make these shows as safe as possible. A lot of bars were very hesitant, but Jacques, when I spoke to management there, the first thing they said was, this is a great idea. It took 3 minutes. We had a 2-minute conversation. 3 minutes later, she's telling me to hire PPE and get everything going. So I'm very, very happy that I work for an establishment that was willing to take safety first.
All right, Kari, how about you? How did Grendel's arrive at the point where, just to be clear, I think in both your cases, you're requiring the operations that you work with to have employees demonstrate proof of vaccination and customers to show that they've been vaxxed. So, Kari, how'd you guys get there?
Well, we've been pretty active about taking as many measures into our own hands to prevent the spread of COVID since the very beginning, regardless of what was being mandated by the state, for example. So we've been working on this vaccination priority to customers and staff that have vaccines since they became available. Prior to that, we were testing our staff in a surveillance mode biweekly. So we kind of transitioned from testing into vaccine proof as part of that program. So it was already built into that program.
So I want to make sure that I understand, because I think there's probably things that I haven't even thought of. How does it work on just a day-to-day level when it comes to implementation? And Kari, I'll stay with you, then we'll go back to you, James. But if I go into Grendel's tonight, what are they asking for? Are they asking for my little CDC vaccine card? Are they asking for something else? Do they accept other things? I actually lost my first vaccination card, so I had to get a second. What are you guys requiring? And how much leeway, if any, do you give customers?
We really try to give people as much leeway in as many ways as possible to indicate that to us or show us with some confidence that they're vaccinated. People frequently bringing their vaccination card with them or a photo of it. And the photos of it, obviously the point here is not security to the point of like, oh my God, somebody could fake a vaccine. What we're trying to do is be as proactive as possible and reward people for their vaccination by giving them privileges and access. So if they have a photograph of their card, if they have their CDC card, if they have an app, say they come from New York or another country that uses an app, we're attempting to get our own app going, working with the Path Check Foundation to use some digital tools that they've been working on. We hope that would make it a lot easier for everyone if there was one in Massachusetts, like the Excelsior Pass. We will even accept the confirmation email from your vaccine appointment. But as long as it matches your ID on your driver's license, your name on your driver's license, which we're checking that anyway if you're drinking.
Right.
So, I mean, there's a lot more personal information on your driver's license than on your vax card.
That's a good point. James, how about if I were to go to Jacques? What would I have to do? And would I have the same flexibility when it comes to providing proof that I would at Grendel's?
Yeah, and I think you just said that so eloquently. It's not about, hunting people down. It's not about punishing people. It's about making sure that safety is coming first. So basically everything that you just said, it's the same as what we're doing. All we're saying is that if you don't have your vaccination or if you don't have proof of vaccination, we just need you to wear a mask. We need you to try and help us to curb the spread of this disease. And, I've said it in a couple other interviews that I've had where, whether it's political, whether it is something you think was man-made in a factory, it doesn't matter. It's a real disease that's killing real people. And we need to treat it with that respect.
So, James, I'm glad you mentioned that. Just so I'm clear, so at Jacques, if you don't have proof of vaccination, then you can wear a mask to be inside.
Yep,
go ahead.
And we do have masks on hand. And, even if you have your proof of vaccination and you're just feeling a little unsafe because there's more people than you expected, those masks are for everyone. And all of that PPE is there for anyone who needs it and feels like they need it.
Yeah, I say as a vax person who still wears a mask in stores, and I appreciate that. Kari, at Grendel's, if you're unvaxxed, can you go in and wear a mask, or is it no admission?
So prior to today, we were allowing unvaccinated people, or we weren't screening for vaccines during non-peak hours. So for us, it's less about the mask because people are not typically masking when they're eating and drinking anyway. Yeah. So there's a lot of unmasking happening. It's more about the capacity restrictions being lifted. So we are thrilled to have them lifted. But if people are going to be close together, we need to ensure that those people are not at risk. And unvaccinated people are at risk if they're indoors and they're in a full capacity restaurant or bar where everyone is pretty much not going to have a mask on no matter what the guidance is, because you can't. Yeah. You need your mouth,
Right,
the mouth is at work there. So, and you're talking and everyone's talking and, and people's voices get louder when there's more people in there. So it's really
also, if you have a beer or two, your voices might get, right.
Yeah, and that happens as well. But so it's really about capacity. So if you're unvaccinated, we offer you outdoor seating only.
Got it.
And that is during peak hours. If it was very slow or empty in the restaurant, we wouldn't feel like it was as big a risk. It would be just like before. So before the capacity restrictions were lifted, we tried to stay safe and we had distancing. So if the restaurant's empty, you're fine. Today, however, the CDC, and what I'm seeing from the way our case rates are rising in Suffolk County, the recommendation is that that masks are worn by everyone in indoor settings in high-risk areas. Yeah. In Suffolk County, which is where Cambridge is a high-risk area as identified by the state. So when I put those two guidances together, we've implemented a mask-wearing policy indoors, which means the staff are masked, diners should be masked when they're not actively eating or drinking, and we are requiring anyone who comes indoors to be vaccinated.
Gotcha. Okay, I want to ask you about pushback.
Mostly, just by the way, because we'd like to see Suffolk County stop being a high-risk area. And the way to get that to happen is for more people to get vaccinated, because it has been the most powerful and effective tool to reduce the rate of COVID.
From your mouth to God's ears. Let me ask you guys about pushback. James, you mentioned people who might think that it was indulging conspiracy theories that have been debunked about the origins of COVID or whether vaccines are good for you or not. I'm wondering how much pushback each of you have had, both from the public but also whether you've had any employees who've said, wait a minute, you're going too far here. I'm just not comfortable with it. I don't accept this condition that you're trying to impose on me.
Yeah. And I'll tell you, the only pushback that I've received when I've had this conversation has been from management who's afraid to inconvenience people. Almost every employee I've talked to, unless, people talk behind your back, so you never know, but everyone I've talked to has said nothing but thank you for thinking of our safety. Of course, the comment section is always a cesspool. So,
it's the worst.
there's people on the comment section who I know have never been in our establishment, but they're coming out because they're seeing it on the news and they have to put in their 2 cents. Which I knew was going to happen.
Yeah.
It's, unfortunately, this virus has become so politically charged that it's no longer about the health and safety of people. It's about the political gains behind it. And it's unfortunate because people are dying.
It's really unfortunate. Kari, have you had any customers, servers, bartenders, anyone say, wait a minute, I'm not comfortable with what you're doing?
Our staff are largely thrilled that we've been doing this. They really appreciated the testing program that we did. We actually started testing again now, even though everyone's vaccinated. There were definitely some people who had real concerns and real fear about getting vaccinated. These are folks who just don't like needles or who didn't want to have a day of feeling crummy because they have, to work and they don't want to lose money. So we've definitely reassured our staff who were worried about the day off from work being sick that we would pay them, and that helped a lot. The folks who were afraid of needles, we really just offered to hold their hand and make sure they understood how important it was and how important it was for them to go through with pushing through that fear. None of them were upset about needing to do that for work because we really just sort of brought them along sort of as part of the whole we're in this together process of keeping everyone safe. It helps that we had a track record of already helping keep them safe by doing testing and generally keeping the conditions safe at the restaurant. So that helped.
Let me ask you each one question in closing. I'd love a brief answer from both of you. Would it be helpful from your vantage point to have the state take more of a leadership role here and say, hey, this is what we want businesses to do? James, I hear you chuckling, so let's start with you.
I wish any part of our government would take more of a leadership role in this. I really and I'm sure you both agree with this, that COVID the entire time has kind of been a just throw everyone out and let's see what happens.
Yeah, I hear you.
Yeah, it's so everyone's trying to figure it out, and it's causing a lot of fights, especially amongst businesses, because no one knows what the right answer is.
Kari, how about you? Would you like to see, for example, Governor Baker, maybe someone else say, hey, people should be doing, vaccinating before they go into a business, for example, or requiring it?
So I actually think a little bit controversially that it's not something that the government should do for a couple of reasons. One, I think the government should encourage businesses to do it. We are really, especially restaurants, right there. We're the types of community-based establishments that are going to be way better at getting a message to people and educating people on the importance of vaccines. And we are also in a position to directly reward them for their actions by things like giving them, a discount or anything, or just giving them a better experience at the restaurant.
But you don't want the governor to step in and mandate.
Well, I think that also people are really more willing to trust a program that's something that's part of capitalism, like the good old fashioned almighty dollar.
That's
like they can spend it wherever they want to. So that consumer choice aspect gives people a feeling of being sort of more in conversation with the process. So I feel like people are more likely to trust and accept vaccine policies and mandates if they come from the businesses that they interact with.
Interesting point.
Because it's coming from a trusted partner that they already engage with.
We got to leave it there.
The government feels a little big brothery. So I think we'd love to have the government give us a reward.
Got it.
For doing the right thing.
Thank you. That's a really good point to end on. Kari Kuelzer and James Grasick, thank you both for going over this with me.
Thanks so much for having me.